Cancer screening among the low income population, a call to action. Cancer screening is looking for cancer before a person has any symptoms. The aim of cancer screening is to prevent cancer deaths and improve quality of life by finding cancer really early and treating them. Most people participate in screening to be sure that they are healthy rather than to find out they are not. And low income populations don't have the privilege to do this. This is a problem because it has been found that low income communities smoke in much higher rates than the rest. So the risk for lung cancer is high in those areas. This is the cause why more than half the cases of cancer in the world arise in people in low income and middle income communities. About 170,000 people die each year from lung cancer, which is by far more deaths than any other cancer. For Americans whose incomes fall below the poverty threshold, rates of smoking still hold at more than one fourth of the group. Low income people continue to smoke at high rates compared with the general population. Nearly all lung cancer cases are caused by cigarettes and other tobacco smoking, although there are localized exceptions. The tobacco industry has had a strong influence on low income people and cultural norms surrounding smoking, targeting low income communities with heavy marketing to keep people hooked on tobacco. Meanwhile, many low income people who smoke reside in communities in which public health efforts have not made as much of an impact on reaching people who most need resources to quit. These diagnoses have the smallest survival differential below low and high income countries, but they are often detected advanced stages in low income countries because no effective screening or early diagnosis techniques are available. In this paper, we will discuss how lung cancer is more prevalent in low income populations, specifically towards men and women. Low income populations also have lower rates of cancer screening and higher rates of late stage disease than do counterparts.
For the social determinant part, we will first start off with intrapersonal. How it begins, friends ask you to try it. Frequent exposure beginning with teens, and African Americans and Hawaiians have increased risk, often due to their education levels. For the interpersonal, family influences. Young teens are most likely to smoke if an older sibling or parent smokes. It leads to a lack of enforcement not to smoke because they are constantly surrounded by it. Why this occurs can be tied back to the saying, monkey see, monkey do. To act cool, teens might want to feel more mature. Low income areas, less education and health risks regarding smoking, and overall lack of support because they are convinced that behavior is okay. Organizational. High cost of cancer screenings is a disincentive, leads to lack of awareness of the problem, and low income equals health insurance is not feasible. For community, media influence, like TV shows and movies. Media influence is a significant contributor because it is highly effective. 1 to 2 minutes of smoking media can change someone for a life with addiction. 20% of high exposed viewers try smoking. And lastly, policy. For need for yearly screening at low cost. Future policy placed for free screening.
Social ecological framework strategies. First is intrapersonal. Leading cause of lung cancer is smoking as stated on the National Cancer Institute website. This being said, the individual must want to quit smoking, otherwise there will be no change. Even though low-income men and women may not have the best social supports, if any at all, there are many groups and organizations out there that can help if reached out to. The NPR states how there are more than 75,000 Mass Health members in Massachusetts that have taken advantage of state-funded quit smoking programs. These specific programs have encouraged and provided the resources for more than half of former smokers to quit. This is just one example of a specific program in a specific state. There are so many in all different states that will provide the needed resources to the low-income population for those who ask for it. Interpersonal. Friends and family can and do make a huge impact on the choices an individual makes. This can either be a good or a bad thing. For example, if everyone you're around is an addictive smoker, that is going to be hard for you to try and quit when you're surrounded by that. Having lung cancer not only takes a toll on you physically, but mentally as well. Coming from a low-income family may cause you to not always have the most positive of people around you as a support system to help you get through the process. On lungcancer.org, it says that a lung cancer diagnosis may bring up a variety of difficult emotions for you and your loved ones. The process you go through is a long and rough one that requires you to have positive people by your side to give you around-the-clock care. Organizational. Treatments for lung cancer are constantly getting more and more expensive as time goes on. This takes a toll on everybody, especially if you are already considered below poverty line. Radiation, checkups, therapy, procedures can be very costly, especially if you don't have insurance. Medicaid helps low-income families by giving them insurance. Though it may not be the best, it does give you what is needed for you to attempt to get the treatment that you need. There are so many organizations out there that will help people when they have lung cancer. This includes, but is not limited to, the Foundation for a Smoke-Free America, Becoming an X, QuitNet, American Cancer Society, the government, American Heart Association, Nicotine Anonymous, American Lung Association, tobacco companies, and for-profit companies. Every organization has different benefits to help different types of people because not everyone is the same and not everyone struggles in the same way. Community. As for media, an article on the Centers for Disease Control and Prevention talks about the tobacco industry marketing and targeting. It says that tobacco companies often target their advising campaigns towards low-income neighborhoods and communities. This is due to the fact that people with a lower socioeconomic status tend to smoke more, as found in many different studies. Media often targets the people of poverty and shows smoking as something to relieve stress and not as the horrible thing it actually is. In lower income communities, tobacco companies often target specifically women through distribution of coupons, point-of-sale discounts, direct mail coupons, and even development of certain brands. They do this because they know that no matter what, these customers will keep coming back, giving them their business. And finally, policy. The Affordable Care Act mandates that commercial health insurance plans must provide preventative services rated grade A or B by the USPSTF without copayments. This benefits low-income people because they can get the screening done and hopefully be able to catch the cancer in time without having to pay a dime. One of the many reasons why people don't go to the doctor for preventative screening is due to the fact that they can't afford it, but this policy allows them to.
Young adults in low-income populations are continued to be influenced on an everyday basis. Smoking has grown to be a public health concern in many local communities. Many individuals do not have the money or resources to find cancer exposures, such as in cancer screening. Due to the low rates of cancer screening in low-income populations in particular, it is difficult because many people die without medical care or at least without a diagnosis before their death. Individuals in low-income communities face behavioral struggles and are heavily influenced by social media. A solution for this is to take advantage of the state funding quit smoking programs such as the one we discussed in Massachusetts. Individuals in low-income communities will continue to be encouraged to take the path of self-actualization. As organizations and different associations, such as the American Cancer Association, reach out to young adults every day in the community, public health officials wish to find a positive change in these low-income communities. Smoking will continue to be a rising problem in the United States, specifically low-income communities. This is a health concern that should continue to be resolved and provide a positive reinforcement to young adults.